A Houston woman discovers she has a rare heart condition. A teen boy called a miracle, living strong and fighting the odds. We wanted to share the stories of two inspiring people. First, it was a car accident that made the morning news in 2010. One of the only survivors, a pregnant young mother who happened to work at Shriners Children's in Galveston. Soon after her son's birth, he became a patient there. And as Shriners always does, they're still caring for him today. Tony Pierre has grown up coming to Shriners Children's, Texas.
It was really just a blessing.
His mother, Crystal Pierre, survived a car accident when she was only 2 months along in her pregnancy.
My sister was driving, had a stroke, and died immediately. It had just newly rained, so there was nothing that we could do. To be newly paralyzed on top of all of that, and to have to keep the baby growing inside.
Crystal made it to full term and says she knew from previously working at Shriners, Tony losing his leg was something they could heal from.
You can't bring people back, but I could get a wheelchair and I could figure out how to walk, or we can get a prosthetic leg.
Pediatric Orthotic and Prosthetic Services, or POPS, is on site at every Shriners Children's location.
He's come here basically since he's a baby.
The benefit to it being right here is the staff, like Elise Reagan, works directly with children to create prostheses specific to their needs and abilities.
I'm gonna just make him taller. Okay. And then replace that strap.
Do you know how to swim?
Tony has needed a new leg every summer, and this year it's kind of overdue.
I mean, that one step, he's dropping way down there. He needs something longer.
Yes.
Clearly.
Inside here, they can create whatever he needs. In this case, both the leg and the running blade.
What's the harm in not just wearing this one all the time?
We try to discourage it. The way that you can clear the limb on these and to take full advantage of that blade, you have to swing your hip around. That just makes for poor gait,
Like
can
long
add
term,
stretches.
you can have hip problems because of that.
And if you're sitting in a desk, sometimes it's hard to get in because this doesn't bend.
Tony makes these prostheses work in his favor and always leaves moving, walking, and running better than before.
A lot easier, a lot more agile, and a lot more sleek.
And since Shriners makes sure nothing holds him back, he can become the person he was meant to be.
He's my miracle. I just can't wait to see what he's gonna become, what kind of man he becomes.
Symptoms can seem strange in women. They don't always have the same symptoms as men. And I spoke to one woman who almost died because she had a rare heart condition that nobody suspected she had. Alexandria Smith works at a hospital in Pasadena, HCA Houston Healthcare Southeast. So when she had a seizure at work, her colleagues got to work to save her life.
So my heart was stopping for about 5 to 6 seconds at a time.
The cause was a mystery at the time. A young mom, no other health conditions, and yet it happened again. Another seizure at work. And this time, Dr. Omar Jarudi got to the bottom of it.
Patients that have fainting spells like this from a cardiac cause tend to be older, tend to have comorbidities like coronary artery disease. So this is a really rare thing, and we were very fortunate that we caught it on the monitor.
The diagnosis was sick sinus syndrome, literally meaning the sinus node in her heart is sick, a condition much more commonly associated with people in their 70s or 80s. But Dr. Jarudi said we should have a high suspicion for heart disease at any age when the patient is female.
Those are relatively rare the younger you are. But I do invite everybody to be proactive about their health, get their screening EKGs, their screening physician visits, check your blood pressure, check your cholesterol, all that good stuff.
At just 32, Alexandria got a permanent pacemaker. She's reclaiming her life, thankful to share it with family, and ready to spread this message to her peers.
Go do the preventative stuff, go to your doctor, go get checked out, go do those tests that you think, oh, they just want me to do. Just do it, just in case. Yeah, exactly, because that's exactly what all my friends said when I said, hey, I'm getting a pacemaker put in. They said, oh, wow, you're too young for that. We're too young for that. And I said, we're not.
According to the American Heart Association, almost half of adult women are living with some type of cardiovascular disease. And the scary thing is that women are less likely to receive bystander CPR and therefore less likely to survive sudden cardiac arrest. You can always check out the latest Houston medical news under the health section of click2houston.com. I'm health reporter Haley Hernandez, KPRC 2 News.